All right, we've talked about the behavioral adjustments. We've talked about how to make these changes at the point of performance. But let's also face it, by themselves, they're not enough. Only a third of ADHD children respond enough to those changes to not need medication. And even many of those would still benefit from their medication. But 2/3, and in my experience it's as many as 80%, are going to have to go on medication at some point in life. Maybe it's not this month, maybe it'll be in 6 months, maybe it's a year. Just depends on how compassionate and cooperative the caregivers happen to be, and of course how severe the ADHD happens to be as well. But at some point, these medications will be needed for most children. So I want parents to know them and to know about them. Now, if you're looking for a very good book, the single best book for parents on psychiatric drugs is by Dr. Timothy Willens. Straight talk about psychiatric medication for children. You can get it at the Adhd warehouse. You can get it through Guilford Publications at guilford.com. Willens, W-I-L-E-N-S. It is a parent's book on psychopharmacology. Straight talk about psychiatric medication for children. So quickly, let's go over what's out there. Right? First of all, parents need to know we have stimulants. There are only 2 now. We have had them since 1936 for the amphetamines and 1957 for methylphenidate. They've been around a long time, which means we know a lot about them. We know how safe and effective they are. These are the best studied drugs used in pediatrics and psychiatry. So parents need to understand that. We got a lot of information out there on the safety and effectiveness of these agents. But there still is only 2 stimulants. The news in the last 7 or 8 years has been in the delivery systems, because the problem with the immediate release medications is they only lasted 3 or 4 hours. So they had to be given 2 to 3 times a day. So you had to take them at school, and that created all kinds of problems. So companies went back and re-engineered delivery systems to try to keep the drugs in the body for longer periods of time on a single dose. And they came up with 4 ingenious delivery systems called the 5 Ps, which I will tell you about in just a moment. Let's also understand that last year was published the biggest study ever done of stimulant safety for preschool children with ADHD, and they show that the drugs are effective and are safe down to age 2. So the fact that we are seeing some of these drugs instituted younger in life than previously is nothing to worry about. It looks okay. The preschoolers don't respond quite as well. But apart from that, there are no new side effects, and there's certainly nothing life-threatening about using them. The other new agent we have out there is atomoxetine. This is Strattera, approved in 2003 in the U.S. and about a year later here in Canada. Strattera is not a stimulant. It is not an abusable drug. And it is nearly as effective, though not quite as effective as the stimulants. But for some children with particular ADHD comorbidities like tics, anxiety, Tourette's, OCD, insomnia, and so forth, atomoxetine can be a good alternative drug because it doesn't worsen those comorbid conditions. Now, you should also be aware that this August, the U.S. will have a new drug on the market for ADHD. It will be guanfacine XR. Guanfacine XR will be called Intuniv. This is not a stimulant. This is an antihypertensive drug. It has been used for years with ADHD children, especially if they have Tourette syndrome or bipolar disorder or very explosive behavior, because the antihypertensive drug appears to help lower emotional, impulsive behavior in the individual. But Shire has now been able to manufacture a long-acting version of guanfacine, previously called Tenex, and it will be marketed under the guanfacine label. I expect that you guys will probably see it a year or 2 after we get it. Now let's go back to the 5 Ps. These are the new delivery systems. The first P is the pellet system, the pill system, my apologies. The pills are the original forms of the drug. Ritalin and Dexedrine are in their original pill form. They last about 3 to 5 hours. So what's new? They put them in a pump. This is Concerta. Concerta is a miniature hydraulic pump. So that when you swallow this, there is powdered Ritalin on the outside of this little capsule, and it goes to work immediately. And then on one end of this capsule, barely visible to you, is a laser-drilled hole at the end of the capsule. Inside the capsule is a methylphenidate sludge in 2 doses. A light dose at the beginning, double the dose in the afternoon. When you swallow this, water is going to come into this upper chamber at a continuous rate, and it's going to push down on this, and like a tube of toothpaste, it's going to squeeze liquid Ritalin out for about 10 to 12 hours. That is really neat. And then the pill is excreted in the child's excrement. So you've got a drug that can last around 10 hours. Some kids it's only 8, others get as much as 12, but about 8 to 10 is about right. That is a really neat system. The next system is the time-release pellet system. So we've got the pill, the pump, and now the pellet. The time-release pellets are what Adderall XR involves, Focalin LA, I think, or XR, Ritalin LA, they're all time-release pellets. And guanfacine XR is going to be the same way. So you have different pellets of medication, in this case amphetamine. They're coated with different time-release coatings. Some dissolve right away, some in an hour, 2, 3, 4, up to 8 to 10 hours. So is there any difference between the pellet system and the pump? Not really over the day, but on the time of day there is. The pellet system is better if the problems are greatest in the morning. The pump system is greater or better if the problems are toward the afternoon or late in the day. But other than that, across the day, they cover about 8 to 10 hours. Excuse me, I want to get rid of that. Okay, hold on. The next P, I don't know if you have this up here in Canada. This is the patch. Okay, this is Daytrana. This is methylphenidate in a skin patch. Wear it on the buttocks, wear it on your shoulder, on your hip, wear it all day long. That's it, it's absorbed through the skin, no taking pills. This is a very hard drug to abuse because you can't snort the patch, right? But there's a problem. About 15 to 18% of patients develop a skin rash to this and can't tolerate it, and it's due to the drug. But 84% of the people can tolerate the skin patch. So it's pretty good as an alternative. Oh, by the way, I meant to mention under the pellet system, one of its advantages is if a child can't swallow a pill and you don't have the patch available, you can open the capsule and sprinkle the pellets on food, like on yogurt or applesauce. Doesn't change the delivery at all. So that's another advantage of that. Finally, last August, we have the first drug of its kind ever produced. This is Vyvanse. It's a form of amphetamine. It's called a prodrug, hence the last P. What is a prodrug? A prodrug is where you take a chemical, in this case amphetamine, and you lock it up. Okay, this is the amphetamine right here, and you lock it up with another chemical so it can't work. Now this drug will only work after you split off, in this case, the lysine. You swallow Vyvanse, there's a chemical in your body that will split off the lysine, and now the amphetamine can go to work. This is the first non-abusable amphetamine ever invented because it only works in the stomach and after it crosses through the intestine into the bloodstream. And that's where the chemical is, the enzyme that splits off the lysine. And now it goes to work. So we have a non-abusable amphetamine on the market in the U.S. I don't know if you have Vyvanse yet. It's probably coming this year, I believe. Okay. So just be aware that it's down there. Vyvanse is a little better than Adderall XR, which is the other drug made by the same company, and it's replacing it in the U.S. because Vyvanse lasts 2 hours longer than the other drugs do. This is about a 12-hour drug. It also has a softer onset and a softer offset, unlike Adderall. So it's a pretty good drug. I want parents to understand there are misconceptions afoot about the stimulants. They are not addictive as prescribed unless you inject or inhale them. They do not produce aggression, and they didn't cause Columbine. They are, in fact, able to reduce aggressive and antisocial behavior. They do not cause seizures. You'd have to swallow the whole bottle. So even children with seizure disorders can take these drugs safely. They do not cause tics or Tourette's unless you already are prone to tics or Tourette's, and then they may bring them out and make them worse. Even then, only in about 30% of the cases. The remaining cases do not experience a worsening of their tics, and so children with ADHD and tics can take these drugs safely as long as they're not one of the 30% that makes it worse. And by the way, the worsening is temporary. Stop the drug, the tics will go back to their baseline within a week.